Hi, everyone. I think we're live now. My name is Riggs. I work for a radio.com station out of Milwaukee, Wisconsin, 103.7 KISS FM. I'm a morning show personality. I'm also a mental health advocate, and we're glad you could join us today for our Facebook Live Q&A. Today, we've got with us Rogers, Dr. Ray Ann Hofung, and Dr. Stacy Welch, and they'll be discussing some self-care tips for the new year and how we can support good mental health. Self-care is so very important to many of us, and a lot of us, sometimes we can neglect that. So we'll be talking a lot about that today. And please feel free to comment with any questions you have, and we'll do our best to answer those at the end. So Dr. Hofung and Dr. Welch, thank you so much for being here, and go ahead and introduce yourselves.
Thanks. As Riggs mentioned, I'm a psychologist at Rogers Behavioral Health. I work primarily in Brown Deer, Wisconsin, and supervise several trauma programs as well as depression recovery and mental health recovery. I'm really excited to participate today in this conversation. The importance of self-care has certainly revealed itself in the behavioral health space this year, as our staff deal with unprecedented levels of mental health needs. So I love talking about self-care with my staff, and I'm really excited to discuss it with you all today.
Thank you. And Dr. Welch.
Hi, thank you so much for having us. This is such a fun topic. I am the clinical director of the new Rogers in Seattle. We'll be joining the community here or there, depending on where you're listening, in just a few weeks to months. And yeah, I agree. It's just so important to take a second to talk about good mental health. And self-care is one of those things that's easy not to think about, but so important. So important. So Absolutely. Thanks for having us on.
Of course. And thank you, everybody, for watching. Again, if you have any questions, feel free to drop those in the comments below, and we will read them. We can see them, and we will answer them as we get to the end of our discussion here today. Dr. Hofung, now that we're kind of in like the thick of winter, especially in Wisconsin, I don't know about Seattle, but it gets pretty ridiculously cold in Wisconsin. And generally, a lot of us like to kind of hunker down even more than we do. And now we've got a pandemic on top of it. A lot of people are still staying safer at home and staying indoors. So can you share with us like what type of self-care we can incorporate into our daily lives and help kind of alleviate those down type, maybe seasonal effectiveness disorder, those sad feelings that we can get? And let's talk a little bit about that, how we can do it during the winter season.
Sure. Yeah, Riggs, you're spot on there. The combination of winter and the pandemic has really limited our opportunities to socialize, engage in hobbies, attend sporting events if you're into that kind of thing, enjoy food at our local restaurants, all the things that contribute to self-care and our overall well-being. When we find ourselves doing less of the things that we enjoy or find value in, we may notice that we feel more down in the dumps. And so our mental health and the things that we do are so linked. So what I would say is I encourage y'all to get creative. I don't know if you all saw this cute news story the other day. There was this couple in their 80s. They started dancing in their living room, and their daughter posted these videos to TikTok, and they did these new routines every day. And that was because the daughter noticed their moods were really sinking. And so I could see the pure joy on their faces as they got their bodies moving and they connected with one another. So that's an example of something creative. That connection, it's so important. Virtual meetings are becoming more and more popular, and they're always an option. But as we were speaking about before, we're all getting so sick of screens. So perhaps bringing back the age-old tradition of letter writing, how wonderful to teach our children how to put pen to paper and address an envelope, or just remember the joy of receiving something other than flyers and bills in the mail. And, we talk about connection a lot, and that is really important. But as much as that's important, so is solitude. Many families have been crammed into tight quarters together for a year. So I encourage you all to think about how can you ask for support in enjoying some much needed alone time. Can your partner or close family member take your kids for a walk or take them for a drive? So, and what I would say is make that time, no matter how short, meaningful and rejuvenating. That means stay away from the piles of laundry and engage in some guided meditation or some chosen form of relaxation. Hobbies are also really good. I've been a granny this year. My go-to is crochet.
Nice.
I've made hats and headbands and all of that. And, I have a friend who makes different pies every week. So things like that, and, DIY home projects. My husband's taken that one up, and my house has been in shambles consistently since March. So There's all different types of things that we can do. What I'd say is whatever you do, don't let that magnetic pull of the couch keep you in one spot, binging on Netflix the entire winter. Although we all do need to get a little Bridgerton in our lives.
Right?
Yeah.
They just signed on for a second season, by the way, fans of the show. Second season coming.
Awesome. Awesome.
One thing I like to do is my wife and I, we've started embracing the winter. Is I know it gets so cold in Wisconsin that we think it's cold. I can't do anything outside. But if you put something that covers your ears and like a hat and a warm coat, you can go out and enjoy a walk outside. And as soon as you get your blood flowing and walk for a good 10 or 15 minutes and you break through that first initial, it's cold, this is awful, this is terrible. But once we get through that, I found the mental health benefits of getting out and getting your blood moving and just walking. You don't have to do heavy lifting of weights, or you don't have to go for sprints or 3-mile runs, but like a 20-minute walk is just amazing how you can have a complete change of mindset just by changing your scenery and walking outside. Even you're socially distanced, you're out in the field or walking in your sidewalk around your neighborhood. So beneficial. And I would just say embrace the winter and go out in the cold. Don't be afraid of it.
Absolutely.
We live here. We live here.
That vitamin D benefit is so important, right? So I'm really glad you mentioned that, because Wisconsinites tend to be really low on vitamin D, which can impact our mood as well. So getting out in that sunlight, enjoying the beautiful glistening snow, right on.
Yeah. Dr. Welch, we're talking a lot about self-care and everything, and I'm sure there's a lot of people saying, well, I'm just so busy. I've got, I'm teaching kids at home virtually. I'm doing my job virtually, and I'm just exhausted. So what kind of tips do you have for people, and how do you answer the question when people say, I'm just too busy, I don't have the time to do a meditation or go for a walk? So, I mean, what do you tell to people that kind of give that as a response?
My first response is always, I hear you, I feel you. It's hard, but just kind of jumping off what we were just talking about, just get outside, 20 minutes. I say even a minute, even 5 minutes. It's incredible what just shifting away from whatever you're doing, all that giving, all of the activities where you're putting out energy, just taking literally 60 seconds where you have light hitting your face, a window, good, outside, better. Or even a second where you are not doing something. Anything helps, because it gives your mind and body a second to recharge. And I mean, the other thing, in addition to it's hard, I think a lot of people are working, taking care of kids, doing jobs. I mean, there's a lot going on, but we have bodies and we have minds. And we're not robots, we're more like plants. If we don't get some input of what we need, like sun and water, I mean, we're gonna wilt a little bit.
Hunched over the
dry
keyboard.
And crispy. Yes. So, I mean, that's the other thing is, even if it's small, just to remember, you're a human being. You need care, and it's okay to take a minute.
Yeah. I think being selfish sometimes is okay. As long, I mean, you're not hurting anyone else, but being selfish, we can kind of redefine that word, because you think of selfish as like somebody who's not sharing their mashed potatoes, or they eat the last cookie out of the package or something. But being selfish and just focusing on yourself when you give so much, I mean, we can't fill from an empty cup. So how are we going to do that? If we don't take care of ourselves, we can't take care of somebody else.
Exactly. And I think, that sometimes, especially for parents, it's like the classic thing, like, I'm taking care of everybody, I'm working, I have no time for myself. And that may be absolutely true. And, taking time for yourself doesn't always mean going away by yourself. You could say, with your kids in the room, I need some self-care. I'm getting real irritable with everybody. You guys can hear it. I can hear it. Those are those moments where you hear yourself saying, talk to your sister in a nice tone. And you're like, oh, listen to me, whoops. And those are these moments when, you need some self-care. And I think it's really cool to just say, okay, let's just all take a second to take care of ourselves. What do you need over there? I need some quiet time. And I will do that with my kids and just say, I just need 60 seconds where I'm not talking to any of you. And they know that's a mom self-care thing. And one of my sons is like, I need to talk to people right now. He's an extrovert. I need to talk and have everyone listen to me. And that's his self-care. And we talk about it. So it's, I think I love what you said, Dr. Hofang, and what you're saying, Riggs, about just getting creative.
Yep.
It really helps with the
It does.
self-care stuff.
One of my biggest forms of self-care I can't do as much in the winter, and that's skydiving.
Wow.
Sure.
That's just, everybody has their own form of self-care.
Yep. That would not be mine, but
Right.
more power to
Some
you.
people it is, some people it's not. I think sometimes men, we lack to give ourselves the right self-care, because men always feel like they have to put on a show and like make sure that everything is all right, and we don't have to do anything for ourselves. But even like watching a football game is self-care for a man. I mean, you may not think that it is, but it kind of is. So allowing yourself to do that and not feeling guilty for laundry that's piling up or work responsibilities, and just focusing on, you know what, for this amount of time, I'm going to do this just for me. And even if, yeah, you're right, Dr. Welch, even if it's just a minute or 5 minutes, I mean, it doesn't have to be a long time of self-care, but just something where you tune out the world and you focus just on yourself. It's very important. Dr. Hofung, can you share, there's a word called, or a phrase called behavioral activation. And can you kind of talk about what that is and how it relates to self-care, how that relates to self-care?
Yeah, absolutely. To understand behavioral activation, I think it's important first to understand the cycle of depression. And so what happens is we start to feel down or blue for whatever reason it may be, chemical, situational. And what typically follows then is a loss of energy or interest in things that we used to do. So for me, when I start to feel down or fatigued, I start to skip my workouts, right? And then what follows after that is this cycle of negative self-talk. So you skip a workout, or you don't shovel the driveway, or you don't do that laundry, and then all of a sudden it's, I'm so lazy, I'll never get in shape, I'm a failure, I suck as a parent, I suck as a partner. And of course, that negative self-talk only serves to deepen that depressed mood. And so the mood spirals down, you stop doing more and more, you're beating yourself up more, and it continues. And so behavioral activation is actually an intervention that we use in the mental health field. And basically what it is, it's taking control of that cycle through our behaviors. We're interrupting this cycle of depression by getting active. And so what we ask our patients to do, what we ask ourselves to do, and what I advise any of you to do, is to take an inventory of those routine things that you might have stopped doing, the valued things that you stopped doing, pleasurable things, and we start to add those back into our lives. So building back in routines like brushing teeth, showering, getting dressed as if you have to leave the house, even if you're working from home, adding in those valued activities like book clubs and spiritual gatherings and connecting with friends. And then those enjoyable things that we kind of talked about before with the walking and enjoying the sunlight and the sparkle on the snow, or crocheting and dancing. So in sum, I would say behavioral activation is just like what it sounds. It's getting active, but we use it with intention to interrupt that cycle so that things don't get worse.
And then your behaviors will therefore affect your attitudes, which is not nice.
Yeah, it goes the opposite direction then, right?
Yeah, isn't that great?
As you start to do those little things like, oh, I accomplished the laundry, like go me, right? And then that improves your mood, and then you feel more energized, and you can start doing those things again.
I love celebrating little victories in life. Like, even if it's waking up and getting dressed, like, dude, I woke up, I put on pants today.
Yes.
Like, you don't understand what that means. Like, that's a victory, and celebrating those little things. Like, I cooked dinner for myself. Maybe I drove and I got myself a cup of coffee. Maybe you did something like that, a little victory. Like, the little things will add up to the big things. And you're right about the behavioral activation. I like that. That's a great technique. A self-intervention, if you will.
Yes.
Dr. Welch, we were talking about how kind of our time and how constrained we are for time. So what if we know someone in our life that maybe you can tell that they are in need of some self-care, but they just don't have the awareness of it, or maybe they're stuck in that, like Dr. Hofung was saying, that spiral of, I'm no good for it, I'm not good enough for it, I don't have the time. How do we help those friends out? Or family members?
That's such a great question. I mean, I think the first thing is just part of why we're here today, what we're all trying to do is decrease the stigma of talking about our mental health. Mind-body connection, it's real, and it's so important that we talk about it. So I think the first thing is just to get in the practice of asking each other, how are you doing? How's your mental health? How are you? Um, and to really answer that ourselves as well. So we're giving permission to the people in our lives and to ourselves to talk about how we're really doing. Um, I I have kind of a do and don't. If you have someone in your life where you can just see they are fried, they are not taking care of themselves, and you can see it, but maybe they can't. It's tempting to say you should try a little self-care. But people generally, I think, experience that like you're telling them they're doing something wrong or you're adding another thing to the list. So I always think, if you have someone like that in your life, it's good to just say, hey, I care about you. Is there anything I can do to care for you? Is there even just asking that question can really go a long way. And then, if they say yes, cool. And it kind of opens the door to talking about, I'm concerned for you. You look like you're really struggling. Can I do anything? Can you do anything for yourself? Here's what I'm doing. And having a conversation, much like we're having today, is just seems really simple but it can go a long way. Go a long, long way to helping somebody out. So those are what come to my mind first.
Yeah. Dr. Hofang, I have a question regarding Rogers and I guess, their treatment programs. When people, because Rogers has a lot of great programs, rogersbh.org, of course. And does Rogers, I'm assuming how do they incorporate self-care into their support and their treatment programs? How does that work?
Sure. So from my perspective, this really starts with the staff being healthy and recognizing they cannot put 100% into the care of our patients if they're on the verge of burnout themselves. And this has been a real issue this year. Mental health, depression, anxiety is higher than it's ever been. We have patients, unfortunately, people in our communities that are experiencing suicidality at higher rates than ever. And what that means is our staff have to be even more diligent. They have to be checking in with patients, and they're worried. They're worried about our patients. And so their self-care is incredibly important. So to help them, what I do as a supervisor is I offer weekly self-care groups where my staff get to check in on their secondary trauma symptoms, their burnout and compassion fatigue, and then they get to ask for a need to be met from their colleagues. And we work together to try to help meet that need. Sometimes it's just I need a space to say what I'm struggling with. Sometimes it's an instrumental need. I need help with paperwork or whatever. But then we always close our group by sharing gratitudes, positives, and growths from the week. And I say this to all my colleagues. I want to say this on air to all of you listening. If you're an employer, I really recommend you consider how you can support your employees' mental health. People are not doing well right now. We are not at our best. It has been a hard year with COVID. It's been a hard year with racial injustice. It's been a hard year with a lot of things. And so we need to make our businesses run well. Our employees need to be at their best. And so that's where it starts for me. And then for our patients, it's the same thing that we've been talking about all day. We encourage all those things. I think what we really have to do, though, with them is emphasize self-compassion. A lot of our patients come here with all those negative beliefs. They have low self-worth. They don't believe that they deserve to be cared for. And so we have to start with helping people, all of you listening, recognize you are worthy. You just being here on this planet makes you worthy of care. And so we help our patients challenge those beliefs and gather evidence for why they're worthy of this care. And then we encourage them. That behavioral activation we talked about, that's one of our interventions, right? So we work with them to identify those things that could help them improve their mood or, just care for themselves. And we have them build routines, and there's a lot of structure around it. And then as staff, we check in with them every day. We check in and hold them accountable to taking care of themselves. And then, as we all know, like healthy habits are built over time. And so, pretty soon they just become in the habit of doing these things, and we don't have to push them as much anymore. And then you start to see the depression and anxiety decreasing and moods improving.
That's fantastic. Now we're still talking about self-care, which you hear the word self-care, you think individual, one person, which is normally what it is. But we're also living with families. So I'm wondering, Dr. Welch, Is there a way that you can practice self-care kind of as a family? If you have a small family, maybe you have a couple kids, is that possible? Can we do that?
Yes, I think it's one of the most fun topics for me to think about. So, a couple things. One is, I just love what you said, Dr. Hofong, about everyone being worthy of self-care, and it is so true that if you've been through some really hard times, or if you're struggling with depression or anxiety, sometimes it's hard to connect to that, your own worthiness of care, of self-care. And one of the ways I think it's really beautiful to reconnect with that is to talk about self-care with your family. Because a lot of times, if you ask yourself, what would I want for my child? What would I want for my loved one? It's for them to learn to take care of themselves. And so just talking about that, having that mindset in a family can really help not only the whole family start to get this idea, hey, it's really important to take care of our minds and our bodies, to start to take this scientific approach, like, what is self-care for me? It's different for me than it is for my sister or my cousin or my dad. And that's so helpful to start to have the whole family think in that framework, because it helps us take care of ourselves and take care of each other. And I think everybody can connect with this idea of self-care by thinking, what would I want for someone I love? They might want that for me too, and we all deserve that. One little fun story I have done in my own family was to have my kids when they were little. We'd talk about self-care by them talking about how they would care for their stuffed animals. Like, we had this little dog, Ralphie. And it was really great because Ralphie needed time outside, and my daughter would kind of focus on that. And she'd say, well, Ralphie needs this, and I need this, and you need this. And it just can be a really beautiful way for us all to connect with what we need.
Nice. I like that.
Mm-hmm.
I wanted this. Something was circling in my head that Dr. Hofung said earlier about how we're doing so many screen time things, and a lot of times with employers, I feel like we can just kind of shut the screen and then we go about our business, and remembering that you can still have that personal connection with people. And I think doing that with your family as well, to say, like, we've all been on our screens today, and now let's all focus on each other personally and have some one-on-one connection time, because we start to lose that a little bit if we get too virtual,
Yeah, and just giving permission to everybody that self-care is important, your mental health is important. And if you're a parent, you can also just narrate that. That's a great tool to use. If you are in that moment where you're about to lose it, you need to just breathe for a second. Just say, whoa, I need to take care of myself. Here's what I'm doing. I'm closing my eyes. I'm going to breathe for a second. Okay, I'm back. And just that modeling, kids, of course, do what we do, not what we say.
And you're also kind of setting a little boundary at the same time, which is nice, which is also important.
Actually, can I mention one thing about that, Riggs? I was thinking of, you just mentioned boundaries, and I was actually thinking about that this morning, that saying yes to these things is just as important as saying no. And so I think we're in this stage of life for many of us where there's so much coming at us from every direction, like you mentioned before, like virtual schooling and trying to work from home and do all these things, and people are just having things piled and piled and piled on it. And it's part of self-care is saying no. It's knowing what your limits are and setting those boundaries. And I want to say not feeling bad about it, but we can't control how we're going to feel about it, but accepting that sometimes we need to do those things just as much as we need to say yes to positive activities.
Yes. Saying no might disappoint someone, but it was going to make probably you feel infinitely better because it's a boundary you needed to draw for some reason, and you did it.
Yep.
We have had some questions come through online, so do you mind if we read some questions from the comments? Is that all right? One of the first questions we had to come through is, how can you help yourself stick to your self-care intentions? So I guess it would be almost being self-accountable. So how can we make sure that we are self-accountable and making sure that we're following through with our self-care? I'll let you guys rock, paper, scissors for who answers it.
I can start and then maybe jump in, Dr. Hofung. Well, two things that came to my mind. One is if there's anything that's important for your self-care that you can do with someone else, by all means do it. We're more likely to consistently engage in behavior if we have a buddy. So if you can walk outside and that's a self-care, and there's someone else who can walk, social distancing, it really helps because you're more likely to show up to meet that person than just for you. So that's one. Another thing that I've been doing lately is just using my technology. I'm on a screen all the time. So I'll put sometimes little reminders like, you know, self-care 30 seconds. I did in
Me
preparation
too.
for this.
I do the same thing.
Yeah. Do you?
If it's
Does that
because
help?
I always look at my calendar, and I'm attached to my phone at the always. It's like another appendage. But if I put it in my calendar and I make a conscious effort to put it in and schedule it and say, okay, for this amount of time, I'm going to do something just for me. I'm taking 5 minutes. And I will actually literally schedule it in my calendar so it feels like an event and then something to look forward to and then something to look back on afterwards. So those are great ideas.
Yeah, I would just add to what you're saying that is, I want to reinforce, I guess, what you're saying, Riggs. That's the important piece of it. When we have self-care goals or activities in mind to make them, we say SMART, right? SMART goals. So we want to make sure that they're specific and we have them set a specific time set aside for them. So if I just say, okay, twice a week, I'm going to walk my dog, I can procrastinate quite easily until all of a sudden it's Saturday or Sunday and I haven't done that thing. But if I say
twice on Sunday,
right. But if I say Monday at noon and Thursday at noon, I'm going to take my dog for a 3-mile walk, and you put that in the calendar, you're more likely to do it because you're setting your brain up to anticipate that activity. And we love meeting our goals and our deadlines. And so if that comes up on our calendar, we're more likely to engage in that if it's very specific. So yeah. I like your little 5-minute reminders for self-care. That's awesome.
Yeah, and it's using the technology to your advantage.
Yeah.
We have another question that came in for Dr. Hofung. So they say, I have trouble meditating because I get so distracted by my thoughts. Are there other options that might help? Maybe you could recommend a relaxation app or podcast or books. Thank you.
Awesome question. I'm going to tell you, I hated meditation. When I was training as a master's level student and mindfulness was kind of becoming more and more popular, I hated it. I would be squirming in my seat just waiting for the 5 minutes to pass. So first I would say practice in small increments, 30 seconds of stillness, build up to a minute. I can do 20 minutes of mindfulness now. And I'm not saying everybody will be able to do that. Some people really struggle to be in their own mind for that long. But yeah, their guided meditations are fun. Sleep stories are fun. I found there's an app called the Calm app, CALM, and they have all kinds of meditations, guided sleep stories, soundscapes. So they put together all kinds of nice meditation sounds. There are definitely, I think if you could Google them, you'd find more, but I use the Calm app almost every night, and it's typically a sleep story. And I find that paying attention to the type of voice that's calming for you. Some people might find some voices triggering, and it actually increases their anxiety rather than decreases. So paying attention to the type of voice, maybe the gender of the voice, the cadence of the voice, the accent, all those types of things can help you in selecting something that might be more soothing for you. Dr. Welsh, do you have anything to add on to that?
So Headspace is another one I'm a real fan of. They have some really nice ones for kids as well. I think Calm does too. And then there's a 10% Happier often has these 21-day free challenges that you can do, which is a great way to get some introduction. The other thing, whoever asked that question, take heart. I'm with Dr. Hofung. I was a skeptic of this too when I started. But here's something that has really encouraged me to keep practicing. The fact that you asked that question and you notice that your thoughts are distracting you means that you're doing the practice. And it really helps me to know, okay, it's not that I'm just zen, calm, but it's that I can notice, bring myself back, notice, bring myself back. And that's what actually is linked to all the wonderful outcomes.
That's why they call it practice.
Take heart.
It is practice. You're doing it right. Even if you spend 5 minutes going, I couldn't stop thinking about other things, but I kept trying to focus on my breathing, then you're doing it right. You're practicing, and you can't just sit in front of a basketball hoop and miss 3 shots and just give up. You know, you're going to probably get some repetitions and get some reps. For Dr. Welch, how can we teach our children to practice self-care and without the child feeling as if the activity is forced? Because kids don't like being told what to do. So how can we get our kids to self-care without feeling like almost like it's their idea?
Right. Yeah. Make it their idea. Yeah. Well, that's why I did the stuffed animals thing, because I wanted them to get in the habit and feel what it's like to suggest self-care to something or one, however you see your animals that they care about. A pet can be a great vehicle to engage kids in that mindset of taking care of exercise, food, petting, and snuggles is important. So that's one. And then another is to do it with them, you know, so, and just again, this modeling narration. So if you want them to eat their vegetables, you know, when you sit down, eat some yourself. If you don't like it, that's fine. Just say, well, I'm taking care of my body because I want to be able to run outside. Here we are, we're doing it together. And just to make it joint. And that will help you too, because you need self-care too.
Yeah. A question for Dr. Hofung that we had, another one. By the way, you can leave comments below. We would be glad to read your questions. Is keeping a set structure from day to day for yourself considered a type of self-care? Or would you encourage more of a flexible schedule, not always doing the same thing on Monday through Friday in terms of when you wake up or nighttime routines? Does that make sense?
Yeah, that's a good question, and I just want to say that I'll have some bias in this answer. I come from my profession, and what we do here at Rogers is very structured, and so I will always lean towards structure is best, because just like we were talking about before with scheduling those things in, it holds us accountable. And so sometimes in the moment, we might not always be feeling at our best, and we can't get creative and think of those things that we might need, especially if we start in that spiral, that mood spiral, right? Then sitting on the couch is going to sound better than going for that walk in the snow or playing with your dog. And so what I absolutely recommend is having a schedule and a routine. And maybe as you get better at caring for yourself, you can start to add in some flexibility. And maybe that would just look like, okay, Saturday, 3 hours set aside for self-care, but still being kind of specific about when you're scheduling that time in for yourself so that it doesn't fall off, because self-care is one of the first things to fall off in our busy, busy worlds.
Yeah. Dr. Welch, is there ever a point when somebody may be so low that they don't feel like self-care is really enough? Like they may need to take it a step further and maybe reach out to a professional like somebody at Rogers. Is there a point when someone can know when they need to do that? And how can we identify that when it's time to go a step further?
Yes, that's a great question. We often think about that point when, you know, someone really needs that extra layer of help. If you really find yourself not being able to function, or you're watching your child or teen, just they're trying, but they just can't do what they would normally do, school, family activities, and you can see moods like anxiety and depression and those emotional states really dragging somebody down. If someone is practicing self-care, you know, you're doing all these things, you're meditating, you're exercising, you're working, you are functioning, and you just constantly feel low or sad or hopeless or teary or anxious and panicky, that's a good time to say, you know, you just might need someone to come along and help you. And that is what we do, of course, at Rogers. In Seattle, we'll have our child anxiety and OCD in teens, and then depression recovery. And those are, you know, I kind of think of them as places where people can go to learn what they need to do to take care of themselves, but with a team to help out. So thinking about functioning, or just if it's so distressing and nothing seems to help, it's a good time to reach out and ask for help, and that's okay.
Yeah, it's all such a sign of strength to ask for help. I mean, a lot of people think that they're going to be judged, or I'm weak, I can't handle this on my own. Especially men, we get like that. I should be able to deal with this all on my own. You know, it's okay to not be okay, and to reach out and say, hey, can I get some help? Maybe help troubleshoot this a little bit. You know, sometimes you can't fix everything on your car. I don't know everything about cars. So you got to go to a mechanic to get it fixed. So, you have to go to somebody to help you work on a golf swing. Or even Aaron Rodgers has a conditioning and strength coach. So sometimes even the best people have trainers, So he doesn't just walk on the football field and make magic happen, though maybe he does.
Riggs, can I add a little bit to that?
Please,
Last
go ahead.
question too. I really want to emphasize those thoughts and feelings of wanting to die as an important indicator of needing more help too. We know, like I mentioned before, that suicidal thoughts have been on the rise over the last year. And so if you're finding yourself in that position where you're thinking about wanting to die, maybe making plans for how to do it, and you just can't seem to get yourself away from those thoughts, please do call. Please call in. I mean, people can start at the traditional outpatient level where they're seeing somebody once a week, or call Rogers for help, or any other organization. Like, it's not a business thing, it's a getting help thing, because there is help for those types of thoughts, and a lot of these strategies that we talked about today can work. But also, we can't ignore the importance of being seen by an integrated team where there's a psychiatrist on staff too, because sometimes we need that adjustment that can only be made through medications as well. So some of this can't be moved just through behaviors. And I just want to make sure that point is heard loud and clear to everybody, that it takes a combination approach.
Yeah.
Definitely. Thank you for bringing that up.
And something real fast that people could do, if you're wondering, am I at that place? Is my child, is my loved one? A couple of good places to go would be the Anxiety and Depression Association of America has a great website. You can read stories of other people and take self-assessment quizzes, and just a good place to spend a little time if you're wondering. International OCD Foundation is another great place if you're wondering about certain kinds of anxiety. Just to learn a little more. And if you relate to some of what you're reading, it's a good time, as you said, Dr. Hofong, to make a call.
How is Rogers handling part-time hospitalizations with COVID going on right now? Is it all virtual, or is it face-to-face? Is it a combination of both?
Really good question. It's a combination of both right now. We are trying to be as flexible as possible and offer virtual for folks who have medical conditions or just fears around COVID, maybe have transportation or other psychosocial barriers that prevent them from coming into the clinic. So we offer virtual for those patients, but we also do know that a lot of people just need that routine of getting up, coming on site, want to be in person. And so most of our programs offer an in-person option, and we're very quickly moving back to all in-person options for our programs. We, of course, are as safe as can be. You saw me gear up earlier before the show started. All the staff wear goggles and masks. All the patients wear masks. We do temperature screenings every single day at the door for all staff and all patients. As soon as anybody has signs or symptoms of COVID, of course, we ask them to go home and get tested. So we've been doing a really good job at keeping people safe so that they can come into the clinic and experience the full benefit of our programs.
Yeah. Is there a way to tell or maybe know if somebody needs inpatient? How would we know if somebody needs inpatient at Rogers?
Inpatient?
Yeah.
Typically, that's if people are experiencing those thoughts of suicide and moving towards that, making a plan and acting on a plan, or if people are experiencing like psychosis, like hallucinations or delusions or paranoia at a level that just is preventing them from functioning. That might be a group of people that would need to go inpatient, and inpatient stays are, 5 to 7 days, and there the psychiatrists and therapists help people get stabilized and into a better place to where they could then maybe step down to one of our partial hospitalization or intensive outpatient programs and start getting engaged in some of those strategies we talked about today. And we also look at the functioning, like Dr. Welch was saying before. If you're unable to work or you're unable to engage in school, or some important part of your life has fallen off and you're unable to function in that area, that's an indication too that you might be appropriate for one of our more intensive programs.
And just, I wanted to add something to what you were saying about the dark feelings and people feeling suicidal. Is if you know someone that you think they may be thinking that, is to not be afraid to ask them that point blank. Are you thinking of suicide? And people are afraid to ask that question so much. And research has shown time and time again that that's not going to plant the idea in someone's head, because there's this misunderstanding out there that if you ask someone about suicide, you're going to plant this idea in their mind. When in actuality, if that idea is there, it's already there.
Yep.
And you asking them about it will make them open up often and talk about it. And then they'll start to just emotionally vomit a lot of times and just tell you, you know what, this is, and then they'll come to the realization that that's probably not the best option. And don't be afraid to ask that question, because it's a difficult question to ask, but sometimes it's a very important question to ask, and it can save someone's life. So don't be afraid to ask that question and say the S word, suicide, because it could save someone's life. So do we have anything else to add? Because I think we can wrap up. You guys have been great. Thank you so much, ladies. I really appreciate it. Thank you for joining us. We hope it was helpful to everybody watching. You were helped to learn a little bit about self-care and how we can incorporate that into our daily lives. Dr. Hofung, Dr. Welch, thank you for your time. I know you're very busy women. You're very, very intelligent women. So we need people like you in the mental health field to help everybody navigate our brains. So thank you so much. And if you have any other additional questions and we didn't get to those, feel free to send a DM to Rogers Behavioral Health and they can get back to you. RogersBH.org is the website for more information about mental health and addiction treatment programs. That's the website. We hope everyone stays well and stays healthy. And if you're a Packers fan, go Packers. Thank you for watching.